Hello everyone, this is Sachin and welcome back to another video. Today our topic of discussion is AIDS. In this video we will be discussing about syndrome, that is AIDS. A syndrome is nothing but a group of symptoms occurring at the same time, or you can say that a group of disease occurring at the same time to a same person due to a specific reason that's called a syndrome. So we're going to discuss basics of this AIDS. So let's begin. As you can see here, acquired immunodeficiency syndrome, it's the full form of the AIDS, that is acquired immunodeficiency syndrome. That means it is a kind of immunodeficiency which is acquired. It's not a kind of innate, it's acquired, that is enter in your body up to the birth time. It's not a genetic, it's kind of acquired syndrome. So here it is given as a chronic potential life-threatening condition. That means it's a chronic. The word chronic explains here that it lasts for a long time of period and potentially life-threatening. That means it is very dangerous for the life. Even it causes death also in many reasons. Caused by the human immunodeficiency virus HIV by damaging your immune system. You can see here the very first thing what the HIV virus do to a human body, that it destroys the immune system of a body so that it cannot protect you from other disease that is recurrent in your nature or your surrounding. um, it is written here that the body's ability to fight infections and disease, all the abilities which fight the infections in a nature is lost just by the attack of this HIV virus. So going to the next slide, that is you can see here HIV, human immunodeficiency virus. It's full form of the HIV, a virus that attacks the body immune system. This is how the virus actually look like. The very first job of this virus is to destroy the immune system of the human body uh, in order to make the complete syndrome. Here seeing the next slide of the AIDS, that is the virus can be transmitted through contact with infected blood semen. It is showing that how the transmission of the virus takes place. It is given here infected blood, that you can see if a blood is infected with this HIV virus and that blood is somehow entered into your body, then you will be also suffering from the AIDS. And the semen on the vaginal fluid, semen is nothing but your sperm. And the vaginal fluid, it's a kind of fluid that is present inside the vagina that get exchanged while the intercourse. Within a few weeks of HIV infections, flu-like symptoms appear. Here you can see that within a few weeks of infections, like as if you got infected with the HIV virus, then within a very few weeks you will have symptoms like flu, such as fever, sore throat, and the fatigue. Fatigue means you can say that it's kind of a dizziness, laziness. You won't be able to do anything properly. You will be stressed and very much confused about the things. Then the AIDS disease is usually asymptomatic, and after that time, this disease will be asymptomatic, or you can say this syndrome will be asymptomatic. There will be no any specific symptoms about it. It will disappear all its symptoms until it progresses to AIDS. Means you can say here until it comes into its final stage, there will be no any specific symptoms on your body. AIDS symptoms include weight loss and fever, night sweat, fatigue, and recurrent infection. That means these are the major symptoms which occurs while the syndrome is completely um, on your body. Weight loss, you will the patient's weight will be lost very incredibly, and the fever, and there will be sweating in the night time, fatigue, and recurrent infection. You can say that whatever the infection going into your surrounding, if suppose any kind of disease is in a surrounding, then the infection, the rate of infection will be very high as compared to the normal people. If we talk about the patient who is suffering from that syndrome, and you can see here in the next line it is mentioned that no cure exists for the AIDS, but strict adherence to the antiviral regimens can dramatically slow the disease progression. This is showing that there is a no specific cure for the disease, for the syndrome. We haven't discovered any kind of medicine, but we have some medicines available in our market that can slow down its progress. It can give some extra time to the patient's life, can add some extra days by the use of these drugs. it can slow down some symptoms that occurs. We'll be looking how the AIDS virus, the HIV virus replicates inside the host cell, how what it does after entering into the human cell. So as you can see here in the very beginning that this is the HIV virus after entering into the human cell. It converts itself into the complementary DNA, that is cDNA, with the help of enzyme that is called reverse transcriptase. After this RNA get converted into the complementary DNA, as you can see here, this is the complementary DNA, or you can say, or the viral DNA. Now this viral DNA incorporate with the human DNA or the cell DNA, whatever the DNA genetic material we are having inside our cell. Just after the incorporation of the viral DNA into the human DNA, it starts its multiplication and the replication. Just after completing the multiplication or replication, the new viral is produced by the infected cell. That means whatever the viral DNA is entering into the human cell, that cell is being infected by that specific viral DNA, and this viral DNA is producing many new copies um, of itself, and after reproducing its copies, it makes its own individual viruses along with that cell. After being completely mature, it leaves that infected cell, and as soon as it leaves the infected cell, the infected cells dies. That is how the HIV virus replicates inside the human body. So next we are talking about some histories about this virus. First, it was recognized in 1981. So the first case of HIV was recognized in 1981. That was in USA, one of the largest epidemic of the 20th century. It is one of the largest epidemic of the 20th century. That means there was no any greater epidemic than this in the time of 20th century. But as you can see here, 21st century, the new epidemic is going all over the country. That is coronavirus. So now the next point is approximately 37.7 billion people living with the HIV by the end of 2020. Here the data is given. It is by the Google. There may be some kind of changes because this data were updated many times ago. It shows that 37.7 million people were alive by the end of 2020, and the next point wants to say that 79.3 million people infected with HIV till 2020. So you can see here the number of infection is very high as compared to the fatality rate. The fatality rate of this infection is very much high. 79.3 million people were infected with this virus. From the 79.3 million people, only 37.7 million people were alive by the end of 2020, and rest of the patients were died just due to this virus. So you can imagine that how dangerous this virus is. There is no any specific cure. We will discussing about it in the further slides. So next slide, we have the main routes of this virus transmission. The first one is that the sexual transmission, main mode of the transmission. This is the main mode of transmission, how the virus is transmitted from one body to the another body. It is given here in the next point that 70 to 80% of all HIV infections occur just due to this process by the mode of sexual and parental. You can see here the virus is also transmitted from one body to the another body with the help of blood transfusion. Blood transfusion, you can say, while you are receiving blood from any blood bank, suppose the blood is infected and you're getting that blood injected into your body, then also you will be infected by this virus. So one should must be careful while receiving any blood from any blood bank. You should get proper checked about the blood whatever you are getting. Now the next we have, it is a contaminated needle pricks. That means whatever the needle contaminated, like if a doctor or the nurse is using same needles for different persons, if any one of them is infected with that HIV virus, then all the peoples for whom the needles are being used, they will also be get infected by the same virus. Another next point is similar to the point upper we have discussed already, that is needle sharing among HIV infected drug user. You can see that there are many narcotic products the people use to take that with the help of needle sharing, because that's very in the needle there is amount is very less, so people used to share with the needles. So this should not be done. It should be avoid to prevent this infection. And here the last one is during labor and delivery. That means the virus can also be transmitted somehow by the delivery or the labor of the offspring. So in the further slide we will discussing about the treatment. So already we have discussed that there is no specific cure for this disease. There is no any vaccine because this virus is having a very high rate of mutation. It mutates its structure, its genetic material from person to person. Like if a person is having this virus, it will have some kind of different genetic material, and as soon as it enters into the another body, it immediately make changes into its structure. That is why we are not having any specific vaccine for it. So if somehow we can slow down its mutation, then only we can discover its vaccine. uh, so the next point is the treatment can help slow progression. Already we have discussed that only we have some kind of drugs available in the market that can slow down its progression, or you can we can add some extra days to the life of the patient. And the next point is that the most effective treatment is the antiviral therapy, ART. It's a kind of therapy that is antiviral therapy. By the use of this, we can slow down the progress of the disease, as we have already discussed in the earlier slides. So moving towards the next slide, that is prevention from the AIDS. So we already have discussed that there is no specific cure, so the only last option we are having prevention. We can prevent this disease by spreading from one person to the another person. There is a many ways to prevent this disease, and these are 100% successful. Being careful while the blood transfusion, as we have discussed already. Be very careful while receiving or donating the blood, and not to share needle and injecting equipments. Not to share needles and injecting equipments, that is the while the taking drugs. And you should have protection like a condom while having intercourse, and avoid having intercourse with multiple unknown person. Here the line wants to say that stay away from the unknown person in case of intercourse, and get yourself tested at a regular interval of time. You must have a specific time interval of time that at the time you should test yourself for this virus, so that suppose if you get detected for this virus, you may get treatment, or you can increase the life. So this was all about the topic that we have discussed. Now thanks for watching this video.